Hello there, and welcome to this episode of Happy Birthday Wellness Quiz, day 202, your health promotion and disease prevention podcast brought to you by Kiki Afia. My name is Subiri Obwogo. I'm a medical doctor and specialist in public health medicine. Today we're going to discuss 9 ways to prevent diabetes. Diabetes is a worldwide epidemic. About 422 million people worldwide have diabetes. The majority of whom live in middle and low income countries. And about 1.5 million deaths are directly attributed to diabetes. Type 2 diabetes is the most common form of diabetes. It tends to run in families and accounts for approximately 85% of all the cases globally. At the same time, we know that about 85% of individuals diagnosed with type 2 diabetes will have a positive family history, meaning either their parent, their siblings, or their children will also have diabetes. By comparison, about 90% of persons who get type 1 diabetes do not have a relative with diabetes. The cause of diabetes mellitus range from body's immune system attacking the insulin producing cells to a combination of inadequate insulin production or tissue resistance to action of insulin. Type 1 diabetes is diagnosed frequently in individuals of Caucasian ancestry, although it can occur in any population. Type 1 diabetes is most frequently diagnosed in younger individuals. However, it can develop it at any age. With the increase in childhood obesity, we are beginning to see type 2 diabetes in this age group. Yes, and type 1 diabetes also requires insulin resistance, insulin treatment, whereas type 1 treatment can either be insulin, tablets, as well as diet, exercise, and weight reduction. So in terms of the how to prevent diabetes, there are what we call modifiable risk factors and non-modifiable risk factors. The modifiable risk factors are the ones that you can do something about it, while the non-modifiable risk factors are the ones we can not do much about it. The top on the list is basically diet. A balanced diet rich in fruits and vegetables, whole grains, legumes and nuts, as well as seeds will protect you from getting diabetes. The way this works is because of weight. It prevents you from, this diet will protect you from adding excessive weight. Physical inactivity will also contribute to diabetes, so you need to be physically active. You require about 150 minutes of moderate intensity activity. That is 30 minutes a day for about 5 days. Now, we talk about moderate intensity activity. Talk about things like brisk walking, walking up and down the staircase, or cycling on a flat surface. Now, how do you know if you're achieving moderate intensity physical activity? It's something we call the talk test. If you're able to talk but you can't sing during the activity, then you have achieved moderate intensity physical activity. The other risk factor is overweight. So it means you're overweight. You need to ensure that your weight, the BMI, is below 25. BMI is the ratio of your weight to your height. So the way of losing weight is by creating an energy deficit of 500 kilocalories per day, so as to lose half a kilogram per week. So that's about a deficit of 3,500 kilocalories per week. Remember also that you need to also exercise after the initial weight loss, because exercise is what will help you maintain your weight after you have lost it. You need to manage your stress in healthy ways, because stress is another risk factor for diabetes. Alcohol intake needs to be limited to about 1 unit of alcohol a day for women and 2 units for men. You also need adequate sleep between 7 and 9 hours to prevent diabetes. And of course, if you're smoking, you have to quit smoking. Now, cardiovascular risk factors need to be managed, things like high blood pressure, things like high cholesterol, because they also are risk factor for diabetes. Now, the non-modifiable risk factors are things like age, genetics, as well as stress. But the good thing is that, remember, things like if you have a balanced diet, you're physically active, you maintain a healthy weight, you're on treatment for diabetes, then you can modify the genetic risk factor for diabetes. In terms of physical activity, I talked about moderate intensive physical activity, where you require 150 minutes per week. If it's vigorous intensity activities, you require about 75 minutes per week. Here are things like jogging, running, swimming, bicycling uphill, jumping a rope, constitute vigorous intensity activity. If you're doing vigorous intensity activity, you can divide it into 25 minutes a day, but remember, don't go more than 2 days without activity. Now, there are studies to show that you can prevent diabetes. This study was published in the New England Journal of Medicine, where participants were studied in terms of how they can prevent diabetes within 10-year period. There were about 3,000 participants. 48% were overweight. In other words, they had a risk of getting diabetes and increased risk of getting diabetes in the next 10 years. They are randomized to 3 groups: TLC, the therapeutic lifestyle changes of diet, exercise, and weight loss, as well as metformin. Metformin is a drug for diabetes, treating diabetes, and also placebo. The results are very astounding. People on TLC arm had a reduction in the risk of developing diabetes mellitus of 58%. There was 5% reduction in diabetes incidence in people with therapeutic lifestyle change, compared to 11% in the non-therapeutic lifestyle change arm. Metformin was also helpful in delaying onset of diabetes by reducing reduction in risk by 31%. But you can see therapeutic lifestyle change, diet, exercise, and loss of weight was much better than metformin. So thank you very much. This podcast was brought to you by Kike Afya. My name is Subiri Obwogo. I'm a medical doctor and specialist in public health medicine. You can support us by liking, commenting, or sharing. You can also use the M-Pesa till number 766-500 or the mobile number 0720-958250. This is basically to enable us reach more people. Until next time, bye-bye.